Hello, this is Dr. Kelly Donohoe from Magnolia Psychological Services, and today I want to answer a question that is burning in the world. And that question is a therapist basically just a paid friend? No, and I'm going to tell you why. So there's a couple of reasons why therapists are different than being a paid friend. Starting with what we like to call building the frame. So as soon as you come into the therapy space, it's a different relationship, a different experience than being with a friend. And I'll give you a couple reasons why. First of all, we are very careful about our boundaries, meaning that 50 minutes or hour that you spend with your therapist is highly protected. The space has been carefully considered to protect your privacy and your time with minimal distractions. We have thought about how we sit together in the room. We are thinking about how comfortable the space is. Everything about the space has been considered, as well as protecting our time together. There's no ringing phones. Therapist doesn't look at their phone. You should have access to a clock as much as they do. You leave all outside devices away. And so the whole focus of that 15 minutes or hour is on just the two people in the room, or if you're doing group therapy, on the people in the room, which is a very different experience than we often get with almost everyone in our life. I'd like you to think about the last time that you spent a full 50 minutes or an hour just fully being with a person in your life who's your friend, etc. So that's the most basic way in which it's pretty assured that your relationship with your therapist is going to be different than a relationship with a friend. So the second way is that as therapists, we have to get a lot of training, and part of that training is to be able to answer the question at any given moment in any therapy session, why are you doing what you're doing? So we aren't just actually sitting there being with you without thought to theoretical orientation. What's happening in the room? Why are we making the decisions we're making as far as approaches to you, what treatment we're doing, what sorts of ways are we approaching whatever you've brought to us? Are we remaining silent? Are we speaking? Are we offering something? Are we validating? Are we reflecting? Why are we doing everything that we're doing? Now, I don't know about you and your friendships, but I don't often sit around conceptualizing about the way I'm interacting with friends. Which brings me to the third point, which is a way that therapists are different than your friends, which is when you come to therapy, it is 100% about you. Now, I don't know about your relationships, but if your relationships are 100% about you and not somewhere close to 50-50 at any given time or over the course of their relationship, then something's not right. So in the therapy relationship, it's really 100% about you. So the therapist is there to hear what you are talking about, to reflect what you are talking about, to dig deep into your world. Now, sometimes, occasionally, do we offer what we call self-reflections as a way of driving forward therapy? Yes. But should we be sitting there chit-chatting back and forth as though the time should be equally spent between the two of us? No. And in what I've just described, this special place created with your comfort, privacy, and needs in mind, and you're sitting with someone who gives you their full undivided attention for that entire time, and internally as well, right? If you're the therapist, you work really hard at getting very good at leaving whatever is going on in your world behind so that you can give your 100% divided attention to your patient in that hour. So you think about it, you're in a special space, you're getting all the attention, and everything is about you. Now, obviously, also, we could talk about theoretical orientation and goals and guides and how we have training to know how to help you get to the next phase in your life, whether we're talking about depression, working through something in your life, anxiety. So whether it's, struggling with mental health and or struggling with life transitions or wanting to have some personal growth, whatever it is, your therapist is ready and prepared to have some ideas about what to do to help you reach those goals. And friends have your best interest in mind and they love you, but they may not also have that training. So those are some ways in which it's different to have a friend than a therapist. So therapists are not just paid friends. It can feel like a very close relationship at times, and it is a lovely relationship, and often very deep bonds are formed in the magic of the space that's dedicated to two human beings connecting and one giving to the other. But it is not a paid friendship. On other videos, I'll talk a little bit more about different theoretical orientations or types of therapy, or when it might be time for you to look for a therapist. So today I just want to answer that question: is a therapist a paid friend? And the answer is no. Though we might really like you, we're not your paid friend. See you soon.